Hi everyone, this is Portia, and I'm going to be presenting a topic I've been very interested in. It's something called the appropriated racial oppression. And just to preface, this is a infographic I made for my psychology class, and I continued doing further research on my own after presenting this to my professor. This is my first time talking about this verbally. I've only submitted this um, in a digital format for my professor to read, but now I'm going to be verbalizing and sharing what I learned and my knowledge to all of you. So I hope you enjoy. All right, so I'm just going to go over the timeline of today's talk, or I guess little TED talk. I'm going to go over the abstract of where this topic came from. It originally came from a research article, an introduction, why this particular topic is important, what is it arguing about, the effects of this topic, this appropriated racial oppression, on dominant group members, and the effect on minoritized group members, and then finally ending with a conclusion. All right, so the abstract. This is written by Versey in 2018, and this topic is particularly new to the field of the science of cultural appropriation and racism. So, the question that this paper really discusses are what are the effects of racial oppression on health outcomes of dominant group members and minoritized group members? And how can we reframe internalized racism as appropriated racial oppression? It also discusses critical research on how racism affects dominant group members and their health in particular. This is important because we normally think about how racism affects minoritized group members, but we don't really discuss dominant group members in a academic setting. So to further introduce this topic, appropriated racial oppression by Versey in 2018, the main argument is saying that in the long term, the act of managing and coping with racism may actually be more harmful to health than the actual exposure to racism. So, this can be perceived racial oppression against oneself, or just seeing it out there on like social media, TV, news articles, even if it hasn't happened to you personally, maybe just seeing it out there and having to cope with the idea that it may happen to you could pose some harmful health outcomes. And the purpose of this paper is to really understand how groups of people use tactics to navigate and cope with this idea of oppression or actual oppression. So I know I've been saying this term appropriated racial oppression, but what does it actually mean? So the idea is that it's a process by which a person's self image is really based on direct and indirect stereotypical messages experienced throughout their life. So direct could be someone saying a racial slur to you or really discriminating you based off your ethnicity or your race. Indirect could be something more subtle. Some people call this a microaggression, and you might not always notice it, but maybe you're subconsciously thinking about, oh, something felt off about that situation, or something just didn't feel right, and you don't know exactly what it is. But essentially, these are racial messages taken in through repeated exposure. And individuals take on racial oppression by absorbing stereotypical messages about how they should be. So if someone is making an assumption about you based off your race, this can be, the stereotypical image that they consume themselves and are now passing it on to you. And now you believe that you should fit into this mold based off what others tell you to be. And so having this response to these messages, either instinctive or deliberate, is a response to what we see as like more normative whiteness ideals. And I can explain a bit more in a bit. All right, so I mentioned normative whiteness ideals. And what does that mean? In a sense, it really kind of talks about what we see as normal in a society and what we see is common among a white dominant group. For example, we have physical appearance, straight hair, in a workplace setting like formal attire, having good manners and behaviors, or even like a specific way of speaking, and how to achieve success and validation. There are specific ways of achieving those things, and not all group members can really achieve that just by being themselves. They have to do something as a reaction to mimic whiteness in order to be accepted into society. And going on to the significance and rationale, why am I even talking about this? Well, I think it's important to examine this because there's not much research about how racism affects dominant group members. While we hear about, minority group members experiencing racism all the time, either externalized racism or internalized racism. And so this a study being done by Versey is demonstrating that we have negative and adaptive ways that affect our health. And just because we take on these stereotypical messages, we acquire different tools to navigate it, and that can compromise our mental health, our physical health, and so on. So it's really essential to recognize that racism affects everyone, not just minoritized group members. All right, so I've been talking all this time about, how it affects everyone, and specifically for dominant group members, what does that even look like? So, threats to worldviews. Typically, individuals develop assumptions about how the world works and their role within that world. For example, people might view their status within a society, either economically, socially, and political, as legitimate and fair. And for white Americans in particular, they have a strong belief of meritocratic beliefs. And this means that if you work hard, then success is bound to follow. And so when that belief system is compromised or disrupted, or they don't actually receive benefits of their hard work, they kind of blame themselves. They don't see that it's a product of a racist systemic view, and that they might feel like if they lose their job, they might blame themselves for the loss rather than an external system that is based on something else outside of their own hard work. So, in the face of this situation, they might experience high stress levels, even like post traumatic stress disorder. And so, these these people who believe in a meritocratic system may suffer greater emotional distress. And in the same sense, there's this perceived loss of status. So if there are demographic shifts in society, such as the US is going to be a higher proportion of people who are of minority group members rather than white Americans, then they may experience fear and anger due to a loss of that perceived status that they had over generations. And along with this perceived loss of status, there are psychosocial costs to racism for white people. And these costs don't have to be as severe as, you know, day to day violence, discrimination, or harassment that people of color usually experience. It could be in the form of, white people having been trained to deny, ignore, or even rationalize racism or experiences that they've seen, happen to other people. For example, there are different dimensions to this. For reactions to seeing racism in the daily life, they might react empathetically. And typically, this is seen more in women where they experience negative reactions, um, more negative, they experience more negative emotional reactions than men. And another dimension of this is guilt. And so, white people who see racism happen might feel guilty. They might feel like their identity is shameful. Being a white person is usually associated with like a colonizer view. And so they might feel guilty that they are white and seeing other people of color experience situations that they don't have to go through themselves. And so if you see that situation all the time, you might experience paralysis or inaction. In a way, you feel this sadness, this empathy, and guilt for others, but you don't know what to do. And finally, there's a fear of others. That's another dimension altogether. People, white people in particular, if they see racism happening, they might be distrustful of other people, or they don't want to befriend people of color because they're afraid of kind of perpetuating that racist believe by accident. And so these cognitive costs of racism, having this reliance on stereotypes and kind of like a distorted view of reality, are all costs that are experienced by white people due to racism. Okay, and moving on to how appropriated racial oppression affects minoritized group members. So, one aspect of this is called respectability and vigilance. This is the idea that people are responsible for presenting an ideal or optimal version of themselves in order to counter the negative stereotypes that may be assigned to their group. And vigilance is the preoccupation regarding one's own public presentation and demonstrating appropriate behaviors. And doing so can lead to mental health outcomes that are negative in a way. For example, maintaining, like if you are a person of color and you have wavy hair or natural texture, some workplaces might not be accepting of that. So they might require you to straighten your hair, dress professionally, speak professionally, have good manners. And this is almost like putting on a mask in order to fit in to the ideals of a certain setting. And so, always trying to put on this mask or actively resist the negative stereotypes that are put onto your group may kind of, have this long term stress about keeping up this mask. You might have negative health outcomes, increased depressive symptoms, worse sleep, and even a higher risk of chronic disease. And because you are always so preoccupied with this self presentation, you might anticipate discrimination. And so you might not even experience discrimination firsthand, but you're anticipating it all the time. You're saying, what if this happens to me? What if that person says something to me? And so that constant idea can be cognitively taxing. Another idea of how appropriated racial oppression affects minoritized group members is code switching. And so I mentioned earlier that there's a particular way of speaking in a workplace, and this is the standard English that is typically a habit of middle and upper class white people. This is preferred in schools, workplaces, and other formal settings. And so by speaking and performing in these ways that are aligned with normative whiteness, minoritized group members can avoid getting stereotyped and shift themselves to accommodate others. But just like respectability and vigilance, these kind of reactions can lead to negative health outcomes. In addition to the other two things I mentioned before, there's something called intersectional complexity. And this is a theoretical framework that really states that there are multiple social categories, such as race, ethnicity, gender, sexual orientation, and so on, that really intersect at many levels of an individual experience. And so individuals who have multiple intersecting identities practice even more vigilance and active coping in order to combat oppression, and this compromises their health and mental well being. And so ultimately, all the health consequences of surface acting, suppressing true emotional feelings to maintain a pleasant and happy outward appearance, and deep acting, where people eventually take on the values of the setting. Both of these are psychologically taxing, and having to shift back and forth between them can lead to other mental health outcomes, like I said earlier, worsened sleep, higher risk of chronic disease, and depressive symptoms. So, all in all, I did talk about both how racial oppression affects dominant group members and minoritized group members. And so, I'm really just going to summarize that, this article that talks about racial oppression can extend to not just um, implications for health. It can also talk more about the link between race and health and other settings. And that is the reason why this is just the beginning of our journey in this research field. But thank you for following along with this presentation, and I hope to see you next time. And lastly, here are my references. Thank you for listening, and I hope you have a rest of your day that is beautiful and joyful.